Good afternoon, everybody. Today is Friday, April 22nd, 2022. My name is Scott McGann with the Falmouth Health Department doing the weekly COVID-19 updates. Our email is health@falmouthma.gov and our phone number is 495-7485. I'm starting off again with the case counts. Just keep in mind, these are not accurate case counts. It's only accurate for PCR, which was, the vast majority of how we counted cases is the only way you can be confirmed. But now with home tests, there's going to be some multiplier that I don't know at this point in time what it is. So when for today, we have 4,265 PCR confirmed, 57 confirmed cases means we probably have a fair amount of COVID. 57 would be on the higher side for any given week prior to the home test, but you add into the home tests. The case counts are moderately high, I would think. There's some multiplier over the 57. It could be 3 times, it could be less. Although there's a silver lining in it, we'll talk about that in a second. And 14 probable cases, again, these are not these are rapid tests done at places like Convenient MD and CVS. So our 14 daily incidence rate, again, PCR-based, went up from 12.60 to 21.1 between 4.3 and 4.16, and our positivity is up to 5%. So even factoring in the home test, the case counts are relatively high. Now, so these are the charts showing a couple of increases. So you see 3 weeks of consecutive increases. Let me jump into here. We still remain in the low category. We're pushing the medium category based on true case counts, because just case counts alone, probably at this current trend, will definitely jump over 200 if things continue to go up as they have in the county. We're still, mid-range, 6.4, when we should have less than, to stay in the low category, be less than 10 new COVID admissions in a 7-day week, so in a 1 week total per 100,000. So we have like 220. So multiply by 2.25. So, I think 6.4 per 100,000 would equate, you multiply. So it's about 20 people that went into the hospital over a 7-day period. But inpatient beds is not jumping up quite. Well, it jumped up 22% for this week. It's at 1.8, but still well below 10% beds occupied by COVID patients. But the case counts are going to, if they're going at this current trend, will jump over 200, which would automatically put us in the medium next week. We'll see what happens, but that's sort of the trend. But the good news is, I think we have a fair amount more cases than we actually are capturing because of home kit tests. Hospitalization is a better metric because it doesn't really matter what kind of test you got if you're really sick and end up in the hospital. So we are pushing higher, so that's just because of the sheer number of case counts. We are pushing towards the medium as far as where we are, but our hospitals in our hospital admissions are up. By and large, the 2 variants for the 2 more recent variants, I think are going to put us more in where we were with Omicron. You see the higher hospitalization rate with Omicron, but not relative to the huge amount of cases we were having. I think you'll see an increase in hospitalizations, but again, it won't match. It'll be more similar to Omicron, the original version, where the hospitalization rate will remain on the lower side, even though the case counts go up. When you go back to January 2021, our case counts were probably about 3 to 4 times lower than it was here, but the spike wasn't showing quite, even though this spike's lower, the case counts, I'm going to use my cursor, might be up in here, where the case counts were way up in here. So the hospitalization rate is lower with Omicron, but the case counts are more. And I think this is, an upward trend. It's not that quick spike that we saw with Omicron original, with these other ones that are around right now. Going to cause some more cases, and it's going to cause a bit of an increase in hospitalizations. But I'm fairly hopeful that it won't result in, the calamities that we had seen previously. You look at ICU beds, that stays relatively low, and percent ICU beds being used. Again, that's got a relation to the severity of the disease. So, I'm seeing cases in nursing homes that aren't turning out to what it was in 2020, 2021, where we had a high death rate, high hospitalization rate. Most are able to be taken care of at the nursing facilities. So we're not seeing sort of that severity issue, but we are seeing an increase because the sheer number of cases gets to enough people that have weakened immune systems and so forth, you can have an increase. I hope I didn't confuse everybody. That was kind of off the cusp. But so as far as the state's concerned, 2,500 cases per day. So we're back up at 4.32. So we're in sort of we're in an increase phase. We're definitely in a phase where we're having increased cases. We've been on an upward tick on most of these here, except for deaths. Again, the vaccine, the booster, the second booster, Omicron not being as severe as it was in previous versions like Delta and the original COVID. Those tend to stay on the lower side relative to the sheer number of cases. If you look at our incidence rate, the state was 24.8. We were below that, 21.1, but still on the higher side. We had 1, 2, 3 other towns that were higher, 4 other towns that were higher. So we were sort of in the mid to high range for incidence rate among other towns. Positivity sort of in the middle at 5.12, higher than the state. Not as high as a few other towns on the Cape. So, there's quite a fair amount of COVID around, just generally more milder. We've got vaccine boosts. We've got, these variants aren't as low respiratory COVID pneumonia type of things and all the other stuff that you would see with Delta and the original. So you don't get the hospitalizations quite at the same rate, but you do get, again, a fair amount of cases. And I can't tell you what the true case count is, again, because of home tests. As far as the hospitalization rate and the death rate among vaccinated people, that's always been relatively close, around 1.6. So 1.6% hospitalization rate among everybody who's gotten COVID in Massachusetts that have been vaccinated has been relatively stable, so that's good. And again, the death rate, people can still die once they get vaccine boosts, especially if they're in a tough situation health-wise. But that remains at 0.46% of people who have gotten COVID that have been vaccine boosted, still remains at half of 1%. Again, second boosters, this is an old slide, but it's still true. Anyone over 50 and older may get a second booster at least 4 months after their first. And then if you have some certain medical conditions, you can be between 12 and 18 and do it 4 months after your first booster. So it's a second booster, which if you've had J&J would be your third shot. If you had the mRNA vaccines, it would be your fourth. And you can mix and match. So nothing's changed on that. Vaccination, I went on VaxFinder. We went on it this week. There was plenty of available slots over the next couple of weeks, so I'm not going to run clinics if there's still availability with the pharmacies and the different places you can get it. So just go on VaxFinder and grab an appointment if you want to have either vaccinated for the first time, your first or second booster. You can go on VaxFinder and get that taken care of. Testing remains, the hospital's still doing it, Convenient MD and the pharmacies. The home kits are your main thing that you're seeing. And you can check out the Barnstable County Health's website as well, or you can go right on mass.gov and see where the most closest and most convenient place for testing. And of course, you can always order home kits. Vaccinations, we added 351 over the last 2 weeks. I didn't update the slide last week, apologize, but it's 351 doses, 202 boosters over 2 weeks, so about 101 a week. 117 second doses, and 32 people decided to get their first dose at this point. And so we're pretty well vaccinated comparative to the rest of the country. As far as variants concerned, Delta's gone. It was back around this first week would be January 15th. It was a little bit of Delta, and all this purple was Omicron. And now this is the BA2 version of Omicron. You can see that wave kind of comes up, and now the next one is the BA2.12.1. I wish they would just give them simple names, but that one's starting to go up. So what you'll see probably is this red variant shown in red will start to increase. You'll see the original Omicron sort of disappear, and you'll start to see a shrinking of the BA2, and it's just waves of Omicron variants, which is better than having waves of Delta variants. So again, the disease is definitely milder. You may be seeing it in your family or with your friends and your group of people that you associate with, that there's more cases and more people are getting COVID. But they're resolving by and large relatively quickly without serious hospitalizations and so forth. But again, if it gets the wrong person, you'll see, an increase. You'll start seeing, some hospitalization increases like we're seeing, just because of the sheer numbers. Again, wish I could tell you a better number, but that ship has sailed with home kids. Mass case coverings. There's been a fight back and forth federally. A judge down in Florida lifted the mandate for travel for planes, trains, and automobiles. You've seen that movie. So that is expiring this week, I think Monday. And there may be a stay of that. I don't know what's going to happen legally. I just flew last week. There was masks were required. So that's supposedly going to go away. We'll see what happens. There's nothing locally other than an advisory in town-owned buildings for mask wearing, but we don't have any requirements. There are no mitigations in terms of reductions in seating or dividers and all the things we did in 2020. And again, primarily because the severity of the disease. Most people are doing fine once they get it. It might suck for a week or so, but most people are doing well with it, and the data, bears it out. So right now, there are no requirements for face coverings. So as a recap, our case counts are higher. There's some number even higher than what I can post for PCR positives. They're high. Hopefully they go down over the next week too. There is an ebb and flow to this, so we're going to sort of ride that wave on and off. As we get into the summer months, it usually stays on the low side. We're at CDC green, though if we get a little bit of an increase, we could be in the yellow based on the 200 cases per 100,000 requirement. And, I'll let you know when I'm there next week. We do this every week. We may start going every other week. We'll have to talk about that. But right now we're at green. There's plenty of testing and there's plenty of vaccine capabilities right now. You can get a second booster. You can check the mass.gov website for boosters. VaxFinder is still a very useful tool to book your appointments. Again, no mandates or advisories in town. There is an advisory in town. It would be the town-owned building. Sorry, I should fix that slide. But again, you can do you and consider how your individual circumstances, who you live with, your individual circumstances on determining your risk assessment on COVID. So that's what I have for this week. So we'll keep an eye on the cases and keep doing what we're doing, and we'll see everybody next time. Thanks.